Top 5 Most Recent American Female Serial Killers. Number 1. Retta Phyllis May, 2017 to 2018. Retta Phyllis May was a 42-year-old United States Army veteran who at the time of the murders worked as a nursing assistant at the Louis A. Johnson Veterans Medical Center in Clarksburg, West Virginia. In 2017, Mays was assigned to work overnight shifts, and simultaneously, elderly patients began suffering mysterious acute drops in blood sugar levels and dying. Because of this, the hospital began an internal investigation of 11 deaths before turning the investigation over to the FBI. Ultimately, investigators found that Mays would inject elderly patients with insulin so as to cause acute drops in their blood sugar levels and their eventual deaths. She reasoned that she did this in order to end their suffering and enable them to pass away gently. Even though there were up to 20 suspicious deaths in the time Mays was working, she was only charged with 7 second-degree murders and 1 count of intent to commit murder due to insufficient evidence of the other deaths. In 2021, Mays received 7 consecutive life sentences plus 20 years. Before we continue, hit the subscribe button. Number 2. Megan Huntsman, 1996 to 2006. In 2014, Darren West, the then husband of 39-year-old Megan Huntsman, was cleaning out his garage in Pleasant Grove, Utah, when he discovered a small white box wrapped in plastic. In the box, he discovered the decomposing body of a baby. He continued to look through his garage and discovered 7 more babies in various stages of decay. Darren West and Megan Huntsman had 3 children together. However, they were drug addicts, and West was prone to be violent towards Huntsman, even serving time in jail from 2006 to 2014. Forensic testing showed that the 7 babies belonged to West and Huntsman. One of the 7 had been stillborn, but Huntsman pleaded guilty to having strangled or suffocated the rest to death as soon as she had given birth to them. No one ever knew that she was pregnant, not even West. When she would go into labor, she would deliver discreetly and alone so as not to draw attention of the others. Huntsman's defense was that she didn't want the babies, and for these murders, she received 6 counts of 5 years to life in prison. Number 3. Vicky Don Jackson. In December of 2000, patients at the Nocona General Hospital in Texas who had only minor illnesses began dying mysteriously. The hospital's administrator then began to notice that during a particular shift, vials of muscle-relaxing medicine, which when overdosed, halts breathing, were going missing. By February of 2001, the hospital began locking the drug away and police investigations commenced. It was ultimately discovered that licensed vocational nurse Vicky Don Jackson was responsible for overdosing patients with this drug when they, according to her, became too demanding and fussy. Exhumations and investigations revealed that she had likely killed up to 10 patients between the ages of 62 and 100 years of age in a 3-month period by administering them with a lethal dose of the drug. Jackson pleaded no contest to 10 capital murder charges and was sentenced to life in prison. Number 4. Kristen Gilbert, 1989 to 1996. In 1989, 22-year-old nurse Kristen Gilbert joined the staff of the Veterans Affairs Medical Center in Northampton, Massachusetts. During her shifts, patients would die mysteriously, and her colleagues jokingly called her the Angel of Death. However, in 1996, 3 fellow nurses reported being concerned about the high number of patients who died from cardiac arrest and how certain drugs seemed to be in short supply after Gilbert's shifts. This report began a police investigation which ultimately revealed that Gilbert would inject adrenaline into patients' intravenous therapy bags, causing them to go into cardiac arrest. Gilbert would then swoop in and half the time resuscitate and save the patients' lives. It was discovered that she did this to assert her prowess as a nurse and also to get the attention of her love interest and ex-boyfriend, who was a hospital police officer, as it was required that hospital police be present in a room in which medical emergencies were taking place. It is estimated that Gilbert was responsible for over 350 deaths during her 7 years at the hospital, but she was only convicted of 3 counts of first-degree murder, 1 count of second-degree murder, and 2 counts of attempted murder, and was given 4 consecutive life terms without the possibility of parole, plus 20 years. Before we continue, hit the subscribe button. Number 5. Donna Perry, 1990. Donna Perry is a transgender woman who was born male and known as Douglas Perry before she transitioned in the year 2000. Douglas had a difficult childhood and grew to lead a life of crime such as reckless endangerment, being in possession of a pipe bomb, 49 guns, 20,000 rounds of ammunition, and solicitation. During an 18-month stint in prison in 1990, Perry boasted to his cellmate that he had killed 9 sex workers over a 4-month period in Washington state earlier that year, but nothing came of this confession. However, in March of 2012, well after Douglas had transitioned to Donna, she was arrested for firearm possession and had to have her DNA submitted to a national database. Her DNA immediately linked her to the 1990 murders of 3 sex workers. During her trial, Donna insisted that she was not guilty because it had been Douglas that had shot and killed the women and that she had taken pains to get gender confirmation surgery as a permanent way to control violence. However, the prosecution argued that Donna Perry only underwent reassignment surgery in order to avoid suspicion of her crimes, and she was ultimately sentenced to 3 life sentences without the possibility of parole. Thanks for watching, like and subscribe.